Hello everyone, good afternoon everybody. I am Sanya Acharya from beautiful Spotless Skin. I am sure all of you must be keeping good health. You must have come across people, especially women, with brown colored patches on their face. They seem like freckle like spots forming large flat patches. This is nothing but melasma. Melasma is a common chronic skin condition in India. According to study conducted across 4 Indian cities revealed that more than 80% of the population present skin color heterogeneity on the face, irrespective of age and gender. This heterogeneity mainly results from hyperpigmented spots and melasma. Indian skin tone more susceptible to pigmentary disorders. It occurs mainly in women 90% and 10% of males of all ethnic age and groups. Around 20 to 30% of 40 to 65 years old women present a facial melasma. Melasma and hyperpigmentation generally ignored as a sign of aging and often misunderstood skin condition. Melasma sufferers have been misinformed about aspects of this common hyperpigmentation issue. This can lead to frustrating setback in treatment. To avoid all these hassles and to keep you informed, today we are here to know about management of melasma from expert. So let's connect today with our skin expert, Dr. Sarmitshta Basak, a practicing dermatologist with over 15 years of experience in the field or live from Kolkata to make aware on management of melasma. Dr. Basak graduated from R.G. Kar Medical College, Kolkata, and went on to complete her diploma and later on master's in clinical dermatology from Cardiff University, UK. Dr. Basak currently practicing as consultant dermatologist at Sarmitshta Skin Clinic, Kolkata. Today, Dr. Basak will share his expertise on management of melasma. So, welcome, Doctor.
Well, thank you.
So, Doctor, when we are talking about melasma, so my very first question is, what is basically melasma?
Melasma is mainly a facial hyperpigmentation. It is a complex process where there is a deposition of melanin at various levels of skin, mainly on the face, and the melanin is slightly different from our normal melanin. They are pendulous in nature, and we have found that there is also increase in angiogenesis, means there is an increase in blood new blood vessels formation in that area, and it is a very poorly understandable mechanism why this happens, and a lot of research has been going on, but still we don't know why melasma happens and what is the exact pathology, and the disease may be at very superficial, that means at the epidermal level. It may involve the dermis in specific. It may be of mixed type, and it may involve, mostly it involves face, but sometimes in very rare cases it may involve in upper part of the body also.
Okay, so Doctor, what are basically the causes of melasma? If we go on to the causes, so what causes melasma?
See, this is a very important, but we are still trying to find what is the cause. We are still not convinced. There are various clues, there are various pointers, but exact cause is still unknown. Pregnancy and hormones are definitely a cause, because earlier melasma, we used to call it mask of pregnancy, and it was known as melasma or mask of pregnancy. But we have seen that it is also seen in males in some percent of cases. So that is it is not so. Sometimes people who are taking oral contraceptive pills, melasma is seen in them. So pregnancy hormones and hormones who take those estrogen, progesterone hormones, those are those may cause melasma. Some exposure, genetics, people who are exposed to sun. So there are certain racial predilection, like it is more common in Southeast Asia, Africa, in this part of the world, more common. And some men who is on finasteride, which is an anti-androgen, they commonly it is seen, melasma is seen in them also. And some exposure is melasma aggravates in people who are more exposed to sun. These are the more common causes, but there may be other causes also.
Okay, okay. That's you said there are many other causes also, but sun exposure can be one of the major cause. Doctor, when we talk about melasma and hyperpigmentation, which is often misunderstood that they are same, so what is the difference between melasma and hyperpigmentation, or it is like same?
See, hyperpigmentation is a broad term. Hyperpigmentation means when there is an increase in pigment condition. So in that broad term, there are various types comes, like any kind of facial or body hyperpigmentation, any kind of increase in pigment, any kind of darkness, we can call hyperpigmentation. So be it lichen planus pigmentosus, be it poikiloderma obsipate, be it post-inflammatory hyperpigmentation, so many. But melasma is only one type which comes under hyperpigmentation. So maybe under a banner, big banner, melasma is one drop. Melasma is one type under a big banner. Hyperpigmentation is a big term under which melasma comes. It's a one point.
Okay, okay. So doctor, what are the symptoms and signs of melasma and hyperpigmentation?
See, hyperpigmentation can happen anywhere in the body, anywhere. See, if you have injured yourself and after healing, that instead of becoming getting the normal skin tone, the area may become dark. That is a form of hyperpigmentation. Maybe you have developed an tinea infection anywhere after a fungal infection anywhere. After the thing heals, there may be a hyperpigmented area. There are another form of hyperpigmented pigmentation which is very common in this part of the world, though it is not very common in other places. It's called cutaneous macular amyloidosis. There are pigmented itchy patches on exposed part of the of arms, back, upper back, legs, and which runs in families. These are called cutaneous macular amyloidosis. That means hyperpigmented dark patches which are itchy. But melasma is mainly seen on face, and they are patchy. There are typical spots, brown, black spots. But a person whose skin tone is fairer, it is lighter. Skin tone is dark, the color will be more dark. And there are various types of melasma. Like if it happens only on this area, this is called malar type. If it happens on the upper part of the face, forehead, cheeks, central part of the nose, chin, we call it centrofacial type. And if it occurs only on the mandible, we call it or only jaw bones, we call it mandibular. In some people, melasma can be seen on upper part of the arms also. So basically, both of melasma and melasma is a type of hyperpigmentation where the skin color becomes dark in particular patches.
Okay, okay. So melasma is a type of hyperpigmentation, as said by ma'am. So ma'am, when we talk about melasma, so what are the risk factors involved for melasma? What are the risk factors for melasma?
Just as I said earlier, that there may be various risk factors, but some of it known, and most of them are unknown. Known risk factors: genetic. If your mother has it, you may develop it in your later part. If you are on oral contraceptive pills, you may develop melasma. If you are pregnant, you may develop melasma. But I have seen people developing melasma in their perimenopausal age also. So hormone, female hormone may play a role. Males who are on finasteride, which is or anti-androgen, means some medicines may trigger melasma. Sun exposure, people who are very much exposed to sun, that may lead to melasma. So pregnancy, hormones, genetics, and sun exposure. These are the risk factors for melasma.
Okay. So, ma'am, as we have talked about the symptoms, what is melasma, what is hyperpigmentation, so how can somebody diagnose melasma?
Melasma diagnosis is very easy because the hyperpigmentation is very typical. It is like a patchy kind of a thing, and light according to your skin color. If you are very fair skin, it will be light brown. If you are dark skin, it will be dark brown, and the color is not uniform. In some places, it is very dark. Some places very it is not, the pigmentation is not uniform, and it is patchy kind of pigmentation. And and we also diagnose it where it is placed, means in which part of face it is, whether it is on the forehead, whether it is on the cheeks, whether it is on the nose, or whether it is on the chin. That is it. And we also sometimes so this is diagnosed more or less. We see it and we can diagnose that it's melasma. It's that easy. But we sometimes take the help of Boots lamp. That is a instrument we use. That is nothing but UV lamp to diagnose at which level the melasma has evolved your skin. Because if you're after using Boots lamp, if there is darkening of the disease, then the disease has evolved only your epidermis. Then it is very easy. But if there is no darkening, at least it has evolved your dermis, then it is not so easy to treat. And if there is mixed kind of Boots lamp fluorescence, then it is mixed type melasma. Then some part will be easy to treat, some part there will be residual patch will be there even if I treat properly also.
Okay. So, ma'am, now we have our live viewers' questions who are watching this live. So, Santosh Kumar is here and he's asking how to manage melasma as it's too difficult. She had taken a therapy, but nothing worked.
Yeah, melasma is really very difficult to treat because melasma tends to come back. That is a very frustrating thing for both doctors as well as patients. Why? We have to, as I said, there are a lot of things we need to understand, and we need to counsel the patients, because a lot of things lot of questions remain unanswered still now. Why melasma happened? I told you initially also why melasma happened. A lot of questions still remain unanswered. Second thing, it tends to come back because it is not only hyperpigmentation. There are a lot of muscular changes also occur under the skin. So probably because of all these things, this melasma becomes very difficult to treat. Sometimes what happens is we don't take adequate sun protection during treatment. That is one reason treatment failure happens. Sometimes what happens, which I personally think, that very few medicines actually work in melasma. And if it is epidermal kind of melasma, there are three types of melasma I just told you. That if it is epidermal kind, it is very easy to treat. If it is mixed type or dermal kind, it usually doesn't respond. And epidermal kind, we usually use exfoliating agents. It usually responds. And if you use proper sun protection, and if you use certain maintenance therapies, it usually stay well. It doesn't come back. But if it is mixed type, as soon as you stop therapy, it tend to come back. Sometimes what happens is our Indian skin are very prone to develop post-inflammatory hyperpigmentation. That is another issue. Maybe during any form of therapy, maybe you have undergone a chemical clean, maybe you have undergone a laser therapy for your melasma. You may not, your skin may not have tolerated that therapy, and you have developed post-inflammatory hyperpigmentation. Indian skin sometimes doesn't tolerate melasma therapy also. That may be a cause. So there are so many reasons. So melasma is really hard to treat in some cases, and sometimes we need a battery of therapies. Means we have to prescribe sunscreen, we have to prescribe some exfoliating agents, we have to prescribe something oral as well as some procedures to go on to keep our balance. Even after giving so many things, treatment things, but the reason we sometimes don't know why.
Right, ma'am. So, ma'am, we have a live viewers question. So, next question is from Nilima Rastogi, and she's asking, चेहरे पर दाग धब्बे किसकी कमी से होते हैं? So, what are the causes of the patches on face? Is there any some due to some lack of some diet or something?
There are many reasons. चेहरे पे दाग तो बहुत कुछ रीजन से हो सकता है ना, क्योंकि मेलास्मा ओनली एक रीजन है, मेलास्मा ओनली एक टाइप है. देयर आर वेरियस रीजंस बिकॉज़ दैट देयर मे बी पिगमेंटेड demarcation line which is a familial condition which may happen. There may be a post-inflammatory hyperpigmentation which may happen. You may have burnt your skin with something. There may be an injury. There may be an old acne scar which has left post-inflammatory hyperpigmentation. That may happen. Sometimes freckles, fair skin में freckles हो सकता है. उसके बाद lentigines में still जैसा हो सकता है. Another thing, people who use a lot of makeup and the chemicals in the makeup that may react with sun and give rise to pigments, hypopigmentation. That is called Bill's melanosis, Burlock's dermatitis, and those also can lead to, in the long run, people who are very fond of using cosmetics and makeups, they in the long run may develop this kind of facial melanosis. So there are a lot of reasons which may lead to facial melanosis. So depending on what kind of hyperpigmentation you are suffering, treatment should be different.
Okay, ma'am. So, ma'am, we have a question from Akansha Jain, and she's asking, ma'am, क्या plasma permanent ठीक हो सकता है?
Very rarely. Melasma is a very disappointing disease. Sometimes I have seen melasma to go completely. It happens usually patients who have developed melasma in their pregnancy period. In some % of cases, melasma sometimes goes completely. But most of the time, melasma पूरा पूरी नहीं जाती. Sometimes doesn't hold. You have to take care of your skin permanently. And while we are talking about taking care of skin, sun protection एकदम पहला आता है. First you have to take care of the sun protection thing. We don't have the idea that how much and what kind of sun protection we have to take, because your sunscreen should be a combination of physical and chemical sunscreen, and sometimes only physical sunscreen should have both UVA, UVB and blue light protection. ये सब रहना चाहिए, and your dermatologist will be able to guide you what kind of sunscreen you need and how much. Means 2.5 grams of sunscreen is needed per use means around 2 fingertipful sunscreen is needed for face and neck, or 2.5 gram. Half a teaspoonful sunscreen की जरूरत होती है. But I have seen that most of the people doesn't use adequate amount of sunscreen. That is the reason melasma ठीक से जाता नहीं है. Inadequate use of sunscreen is the primary cause ये treatment failure का. So that is one thing. Another is people tend to use steroid as an initial treatment, which I absolutely don't like. What happens is steroid gives you instant benefit, but as soon as you stop using steroid containing creams, the melasma bounces back. So what I prefer is I prefer not giving steroid. There are other so many demelanizing, depigmenting agents, and those gives very good results, but those doesn't raise your hopes too much. So if you even if you discontinue the therapy, and if those are not, they don't damage your skin, but steroid damages your skin. So when choosing your treatment, while what to use and what not to use, just try and avoid using steroid on you.
Okay, so try to avoid using steroids, as ma'am said. So, ma'am, there's our next viewer question from Tripti Pandey. She's asking, ma'am, melasma is a hereditary disease.
Sorry, I didn't get.
She's asking, ma'am, melasma is a hereditary disease.
Melasma is I can't hear properly.
Hereditary disease.
Yes, yes. I also we discussed it is not exactly hereditary, but what I have we have noticed that in some percent of cases we have seen that if your mother had melasma, you may develop melasma. Not always that मेरा मम्मी का melasma था, अब मेरा तो नहीं है, वैसे नहीं है, but sometimes we ask that you may find that history. It is not always it.
Okay, ma'am. So, ma'am, the next speaker is Abhilasha Dubey asking, ma'am, क्या कोई side effect होते हैं treatment के दौरान?
हाँ, just now we discussed ना, we have to choose what to use, and because the melasma treatment is long-term treatment, we have to choose what to use and what not to use. Fast therapy is you have to choose a good sunscreen depending on your skin type, and depending on your profession also. Means some are very outgoing, some outdoors होता है किसी को जैसे सारा दिन घूमना पड़ता है, उन लोगों को वैसे सनस्क्रीन चूज करना है, and some people are always sitting in front of the computers or mobile, using a lot of mobile. Those people also get melasma. How? Because of the blue light exposure, because of the light exposure. People who are in the film industry, people who are exposed to a lot of light, they are also getting melasma. Why? Because of too much light exposure. They need blue light filters. So iron oxide based sunscreen they need. So in the sunscreen choose करना बहुत important है. But sometimes people whose skin is very oily, who develop acne very easily, so they need that kind of sunscreen which goes with their skin. Sometimes क्या होता है ना, जैसे बहुत oily है, so we will not use sunscreen. So nowadays various sunscreen options are available. Your dermatologist will be able to guide you which sunscreen to use, how much to use. That is the first step. Second है, I just say that steroid gives you instant benefit. Steroid होता है, there are certain creams होता है, those gives you instant benefit. But if you go on using long time, they will damage your skin permanently. So you have to be very careful. Even if your doctor gives you steroid, please note that they give you mainly for 1 or 2 months, not more than that. And just read the doctor's prescription carefully and use only for that period, not more than that. Then otherwise you will face side effects. So वो follow करना है, and even if you develop side effects, always contact your doctor. Otherwise क्या होगा, you will the side effects will remain. Okay? Because your doctor doesn't know that what will suit you, because he or she doesn't know you, right? So you have to just always communicate, तो problem नहीं होगा. But sometimes क्या होता है, we do certain treatments like chemical peels, PRP therapy, which gives very good results. So उन लोगों का उसका भी side effects होती है, but most of the people, if they follow doctor's advice properly, generally people tolerate it very well.
Right. So taking doctor advice is always good, as ma'am said, if you have any kind of side effect or problem. So ma'am, moving on to our next weird question, is Shekhar Mishra asking, is melasma due to some allergy or infection?
No.
Okay, so it's not due to some allergy or infection. So ma'am, Adil Khan is here, and he's saying, ma'am, क्या कोई daily routine में diet में fruits ज़्यादा लेने से melasma हल्का हो जाता है अगर diet सही से लेते हैं तो?
Diet से बहुत ज़्यादा कुछ नहीं है, कोई relation नहीं है. ऐसे if you take a lot of fruits, that may improve your skin quality, but melasma के साथ इसको कोई लेना देना नहीं.
Okay, ma'am. So ma'am, Gaurav is here, and Gaurav is asking कि उनका जो काम है वो field work रहता है, so वो अपने चेहरे का ध्यान कैसे रख सकते हैं?
पूरे चेहरे का ध्यान कैसे रख सकते हैं? Is it related to melasma or what is his exact question?
He's saying कि मैं field work पे रहता हूँ ज़्यादा, यानी कि sun exposure I think it's a lot. So he's asking कि अपने चेहरे का वो कैसे ध्यान रख सकते हैं?
See, this question is not exactly related to melasma, so I would like to answer. आप field work में हो, so आपकी skin के routine में sunblock होना बहुत जरूरी है. तो मैंने तो आपको नहीं देखा, तो which sunscreen will suit you बोलना बहुत मुश्किल है. तो you visit a dermatologist, आपकी skin के हिसाब से sunblock choose करना बहुत जरूरत है, and उस हिसाब से आपको sunblock लगाना बस बहुत जरूरत होगा. And I always prefer not to use too many products. So sunscreen, maybe a cleanser and moisturizer. That's it. Patient की requirement के wise चीज दिया जाता है. If you are aged, if you have fine lines, then only you will need, or if आपकी उम्र थोड़ा सा ज़्यादा हो रहा है, then you will need certain anti-aging products. Not if you are in your 20s, you don't need it actually.
Okay, so Gaurav, as ma'am said, you can consult your nearby dermatologist and consult your doctor. So ma'am, Namrita Arora is here and she's asking, ma'am, मेरे चेहरे पर 1 साल से दाग है, तो क्या लेजर ट्रीटमेंट से ठीक हो सकती हूँ melasma को?
See, melasma is very tricky, and लेजर से melasma ठीक होता है या बहुत tricky है, because melasma का experience with laser is not very good, because sometimes अगर ठीक से laser और laser ठीक नहीं होता है, melasma बढ़ भी सकता है. So please don't try laser on your melasma, because fractional laser होना चाहिए, और vascular laser sometimes helps, but sometimes it may not help. That may aggravate your melasma. So laser is not that good in melasma. So try other procedures like chemical peel, PRP instead. Melasma laser मैं earlier भी discuss किया, क्योंकि melasma complex procedure होता है. melasma हमें अगर basement membrane laser से ठीक हो जाता है, melasma का post inflammatory hyperpigmentation develop कर सकता है, तो melasma आपका melasma जा सकता है, पर दूसरा type of ज़्यादा हो सकता है. So you will not benefit.
Okay, so I hope Namrita you got your answer. That laser is not that effective, right, ma'am?
Yes, not a very good option.
Not a very good option. So ma'am, we have a next question from Shobha Shetty asking, pigmentation किसकी कमी से होता है?
पिगमेंटेशन बहुत चीज की कमी से हो सकती है, डिपेंडिंग ऑन विच काइंड ऑफ पिगमेंटेशन। मिलाज्मा का तो कमी से नहीं होता, मैंने बता दिया, बट देयर आर सर्टेन अदर काइंड्स ऑफ पिगमेंटेशन। जैसे एक टाइप का पिगमेंटेशन मैं बोल सकती हूँ, जैसे विटामिन डी डिफिशियंसी से पिगमेंटेशन हो सकती है, आयरन डिफिशियंसी से हो सकती है, विटामिन बी पर डिफिशियंसी से हो सकती है। इफ यू गेन वेट उसके कारण हो सकता है आपका एकांथोसिस नाइग्रिकन्स एक टाइप का पिगमेंटेशन हो सकती है, जिसमें आपका फोल्ड्स में एंड ग्रॉइन, एक्सिला, नेक, समटाइम्स इन द फेस आल्सो एक टाइप का पिगमेंटेशन, दैट्स एन एंडोक्राइन डिसऑर्डर हो सकता है। हाँ, ये पिगमेंटेशन हो सकती है, बट दीज आर द डिफरेंट काइंड्स ऑफ पिगमेंटेशन। वो फेस से ज्यादा दूसरी जगह हो सकता है। ये डिफरेंट काइंड ऑफ पिगमेंटेशन, डिफरेंट पैथोलॉजी, डिफरेंट पैथोफिजियोलॉजी एंड पैथोजेनेसिस होता है।
Right. So it depends on different type of pigmentation. जो भी आपके
different disease, different pathology.
Yeah. Okay. So I hope Shobha Shetty, you got your answer. Ma'am, there is another question from Suman Yadav asking, क्या विटामिन सी से मिलास्मा के साथ मदद मिल सकती है? विटामिन सी is like I think asking कि विटामिन सी is helpful in melasma.
Vitamin C may be helpful in overall skin pigmentation, but not that much in melasma. First, you visit a doctor and confirm that whether it is melasma or अगर melasma होता है तो there are other medicines which will help you move. विटामिन सी दूसरा टाइप हाइपरपिगमेंटेशन में अच्छा काम करेगा, मेलास्मा के लिए और चीजें हैं जो बेटर काम करेंगे।
Okay ma'am. So ma'am, there are some misinformation about melasma and hyperpigmentation. That is, can melasma turns into cancer? It is not possible. Okay, ma'am. And ma'am, how can somebody prevent melasma? What are the steps he or she can take to prevent melasma?
Melasma, unfortunately, there is no prevention. But if you take care of your skin, means if you take a good sunblock, if you take a good sun protection, then you may prevent worsening, I would say. And sometimes if you don't take oral contraceptive pills, if you have an option, then you may not develop melasma. If you have an option, so because sometimes those are treatments of certain gynecological diseases, so if you have an option, then but if you in pregnancy, if you develop melasma, what you can do, you can't do anything. So that's it. There is no way that you can prevent. And if your gene is the player, so how can you change your gene?
Okay, and then what are the other treatment options available for melasma?
There are various treatment options available. First, there are various treatment creams available, like glycolic acid creams, lactic acid, dosic acid, hydroquinone. But hydroquinone I am not very much fond of, because long-term use of hydroquinone may lead to certain complications, so I am not very fond of. Topical steroid, azelaic acid. The topical steroid also gives you instant results, but I'm not very fond of. I told you the reasons. Retinoid creams, azelaic acid based creams, alpha arginine. There are so many creams. Resorcinol, all have their pros and cons, and there are certain combinations. So we mix and match depending on skin type, depending on response. We prescribe creams, and so after sunblock, these depigmenting creams, there are certain oral medicines which work wonders, like tranexamic acid. We sometimes prescribe tranexamic acid to women and men, whoever can prescribe, because we have seen that there is a vascular factor going on, so we do suppress that angiogenesis. Prescribe this we sometimes do chemicals, it's light facial chemicals which helps. And we do PRP therapy, petrol rich plasma therapy, which is popular nowadays, also known as vampire facial. That is also giving very good results. So that's it. I'm not very fond of laser. Some say it is working, but I'm not finding any good result in it. So I'm not very much fond of laser.
Okay, so very nicely explained, ma'am. And I think we have like your questions also. Question also. So, any takeaway message for all our viewers who are watching live right now?
So, what I would like to say that melasma is one of the commonest and very depressing disease which we face, which we Indians face, mostly Indian ladies, but sometimes males also. But don't be too much depressed because your mother, your I can understand because when somebody see that your face is becoming patchy, it feels, but don't uh, don't try too many over the counter products. Don't use so many steroids that will be harmful. Just consult your doctor. He or she will guide you properly. Because instead of making yourself better, don't harm your skin. Because what I have seen that to make yourself better, you have developed certain so many steroid topical steroid dependent faces that we can't cure after using steroid for long for your melasma. That is really disheartening. So I would request you not to use steroids for melasma. There are other ways.
Yes, and as ma'am said, if you have any such problem, you can consult your nearby dermatologist, right, ma'am? That is always the better option.
Yes.
Yes, so do consult your dermatologist, and I hope whatever question you have asked today, that was a very valuable session, ma'am. Thank you so much. So thank you so much, Dr. Basak, for your valuable time. It has been very informative session for our viewers, and it is great to hear you always. We really look forward for many such sessions for our viewers in coming time. Thank you, viewers, for your participation for today's session, and stay connected to our page, Beautiful Spotless Skin. Thank you so much, and good day to all. Thank you so much, ma'am.